What if your next routine checkup held a hidden danger your doctor never mentioned? Every year, millions of older adults dutifully show up for medical exams believing they're protecting their health. But few realize that some of the very tests meant to keep them safe could actually raise their risk of stroke. It sounds unbelievable, right? You trust your physician, you follow the guidelines, yet tucked away in the fine print of modern healthcare are hidden risks, risks no one talks about. Not the news, not the pamphlets at your clinic, and sometimes not even your doctor. Imagine leaving your annual visit feeling reassured only to experience dizziness, vision changes, or worse just days later. The truth is, certain diagnostic procedures, especially when performed repeatedly or under vulnerable health conditions, can quietly spike blood pressure, disturb blood flow, and set off a chain reaction that may end in a stroke. This video isn't here to scare you, it's here to empower you. By understanding the silent downsides of routine testing, you'll know what questions to ask and how to protect yourself and your loved ones. After age 60, it's no longer just about detecting illness early, it's also about avoiding harm we don't expect. In the next few minutes, we'll reveal 5 common medical tests that may carry hidden stroke risks for seniors and, more importantly, how you can stay safe before your next appointment. If you're over 60, drop a 1 in the comments. If not, drop a 0 and hit subscribe to Health Lab because we uncover what others won't tell you. Let's start with the first test you should think twice about. If you've ever had a CT scan with contrast, you probably recall that sudden wave of warmth moving through your body. That's the contrast dye at work, highlighting your blood vessels, organs, and tissues so doctors can see details more clearly. Sounds reassuring, right? Yet, here's what many people over 60 never hear. That injection does more than sharpen images. It can also place hidden strain on your heart and circulation, especially if you already have high blood pressure, heart disease, or kidney trouble. For some, the contrast triggers a vasovagal reaction heart rate and blood pressure plunge, leading to dizziness, nausea, fainting, or brief loss of consciousness. For others, the opposite effect occurs. A sudden surge in blood pressure, narrowing of fragile vessels, and a subtle rise in stroke or cardiac risk. A study published in the Journal of Vascular and Interventional Radiology reported that older adults receiving contrast-enhanced CT scans showed a markedly higher rate of vascular complications within 72 hours, especially those with hypertension, cardiovascular disease, or impaired kidney function. Put simply, the more vulnerable your system, the greater the potential danger from contrast dye. Take this real-world example. An 81-year-old man underwent a routine abdominal CT after minor digestive discomfort. The scan appeared normal, and he went home relieved. 2 days later, he suffered a minor stroke. The likely culprit? A temporary spike in blood pressure from the contrast injection that allowed a clot to form and block blood flow to part of his brain. This does not mean CT scans with contrast are bad. Far from it, they can detect cancers, blood clots, aneurysms, and other life-threatening conditions. The key is to use them judiciously, not automatically as a just-in-case test during routine checkups. So how can you protect yourself? Before agreeing to a contrast CT, ask your doctor, is this scan truly necessary, or is there a safer option for someone with my age and health profile? Share your complete medical history, especially high blood pressure, kidney disease, heart conditions, or any prior reaction to contrast dye or medications. Always ask, can this be done without contrast? In some cases, a non-contrast CT or an ultrasound gives enough information without the extra risk. Coming up next, another common screening many seniors undergo even when they feel perfectly fine, and why it might not be as harmless as it looks. Now, let's focus on the cardiac stress test, also called the treadmill or exercise stress test. On the surface, it appears smart and harmless. Attach a heart monitor, step onto a treadmill, and watch how your heart performs under pressure. But once you're over 60, especially if you have high blood pressure, a heart condition, or vascular disease, this routine test can quietly become risky. Here's how it works. You're asked to walk, Then gradually increase the pace and incline while your heart rhythm, blood pressure, and oxygen levels are recorded. As the treadmill speeds up, your heart rate climbs, blood vessels constrict, and your cardiovascular system is suddenly under significant stress. For a healthy 30-year-old, this is no big deal. For an older adult, it can be like placing a heavy weight on thin ice. The extra strain can expose weak spots you didn't know existed. Among the possible complications: dangerous spikes in blood pressure, sudden arrhythmias or irregular heartbeats, and in rare but real instances, small tears in delicate blood vessels, including those in the brain. A 2020 study in the American Journal of Cardiology analyzed more than 300 patients over 65 who underwent treadmill stress testing. Nearly 7% experienced harmful events during or soon after the test, including blood pressure surges and abnormal rhythms. The highest risk group were people with pre-existing vascular problems, and these numbers aren't just abstract. One of our subscribers, Margaret from Ohio, wrote to us with her story. She's 74 and has battled high blood pressure for years. Her doctor ordered a stress test just to check in. Halfway through the treadmill portion, she grew dizzy and felt tightness in her chest. Staff stopped the test right away, but the next day she suffered a minor stroke. Doctors believe a sudden spike in her blood pressure during the test ruptured a tiny vessel in her brain. To be clear, the test itself didn't cause the stroke, but it introduced intense stress to an already vulnerable system, which tipped the balance. So, what's the lesson here? Before you agree to a treadmill stress test, talk with your doctor about your full health history and ask, is there a safer way to evaluate my heart? In many cases, a pharmacologic or nuclear stress test using medication to simulate exercise or even a resting echocardiogram can provide the information without the physical strain. And if you aren't currently experiencing symptoms like chest pain, breathlessness, or unexplained fatigue, ask whether the test is necessary right now or if it can wait. Coming up next, we'll look at another routine screening that appears harmless but may carry hidden risks if you're not careful. Let's turn to a procedure that's become almost routine after age 60, the endoscopy. Whether it's your esophagus, stomach, or colon, doctors frequently recommend it as a precaution. Often that's reasonable, but not always. What rarely gets discussed is that if you don't truly need the procedure, and especially if sedation is involved, the potential downsides can outweigh the benefits. Here's why. Most adults over 60 take at least one ongoing medication, and blood thinners like warfarin, aspirin, or Plavix are especially common. When you're sedated for an endoscopy, your blood pressure and circulation naturally shift. Combine those changes with drugs that thin the blood or slow clotting, and your risk for internal bleeding or even reduced brain circulation climbs sharply. In some cases, this can set the stage for a silent stroke. A 2021 large-scale review in gastrointestinal endoscopy reported that patients over 65 who underwent sedated endoscopy showed a notable uptick in transient ischemic attacks, mini strokes, within 72 hours of the procedure. These weren't catastrophic strokes, but they were clear warning signs that something had gone wrong with cerebral blood flow. Consider this real example. A 76-year-old woman went in for a routine colonoscopy under sedation. She felt fine beforehand. 2 days later, she began slurring her speech and lost coordination. An emergency room scan confirmed she'd suffered a mild stroke. Doctors suspected that the blood pressure drop during sedation, combined with her daily aspirin, created the perfect conditions for a clot to travel and block a small vessel. Even though the procedure itself was standard, the mix of age, medications, and sedation tipped the scales. That doesn't mean endoscopies are bad. They can detect ulcers, cancers, and internal bleeding conditions that can be life-saving if caught early. But it does mean you shouldn't agree automatically. Ask your physician to explain exactly why the procedure is needed now. If you have no symptoms and it's simply been a few years, ask whether there's a less invasive way to monitor your health. Also be upfront about every medication you're taking. Ask, will I need to pause my blood thinner before this? What are the sedation risks at my age? If sedation makes you uneasy, see whether the test can be done with minimal or no sedation. For many people, lighter approaches are possible. Coming up next, we'll look at another test that often slips under the radar, one that involves an organ most of us rarely think about, the kidneys. MRIs are extraordinary diagnostic tools. They let doctors see far beneath the surface, detect early warning signs, and in some cases, prevent unnecessary operations. But when a special contrast dye is added to sharpen the images, that's when extra caution becomes essential, especially for older adults and anyone with even mild kidney impairment. The dye used for most MRIs contains a heavy metal called gadolinium. It's designed to leave your body quickly, filtered out through the kidneys. But here's the problem. After 60, kidney function naturally declines. And if you already have chronic kidney disease or don't realize your kidneys are under strain, your system may clear gadolinium more slowly. Small traces can stay behind. That buildup can be harmful. Gadolinium retention has been linked to a rare but serious disorder called nephrogenic systemic fibrosis, which thickens and hardens skin and connective tissue. In its most severe forms, it can restrict movement, impair breathing, and affect internal organs. What many people never hear is that retained gadolinium has also been detected in the brain. Some experts suspect it may trigger subtle neurological effects, confusion, dizziness, disorientation, especially in individuals already at risk for circulation or blood pressure problems. One study in radiology in 2019 followed more than 20 patients over 65 who underwent MRIs with contrast. Within a week, about 5% reported stroke-like symptoms, headaches, blurred vision, and trouble with balance. These weren't full strokes, but clear warning signs. Most of the affected patients had hidden or known kidney issues. Take Harold, a 79-year-old veteran from Arizona. He went for an MRI to investigate ongoing back pain. His physician ordered it with contrast just to be thorough. Harold didn't know his kidneys were compromised. 2 days later, he felt lightheaded, weak, and mentally cloudy symptoms lasting nearly a week. Only after routine blood work did his doctor find stage 3 kidney disease. "Nobody warned me," Harold said. "If I'd known, I would have asked more questions." Here's how you can protect yourself. If your doctor suggests a contrast MRI, ask, can we do it without the contrast? In many cases, the answer is yes. If contrast really is necessary, request a kidney function test first, a simple blood test called a GFR. It provides crucial reassurance for both you and your physician. Also disclose any past unusual reactions to imaging dyes. Remember, the MRI itself isn't dangerous. It's the added substance your body might struggle to eliminate. With the right precautions, you can still get the information you need without putting your kidneys or brain at risk. Next up, we'll look at another routine test, one that seems harmless, even smart, yet maybe nudging older adults toward risky, unnecessary surgeries. The carotid artery ultrasound. It's quick, painless, and doesn't involve needles, dyes, or the clanging sounds of big machines. On the surface, it seems like an ideal preventive screening, but here's what most people over 60 aren't told. If you don't have any warning signs and your doctor's ordering this scan just in case, this simple test can open the door to procedures you may not have needed at all. The carotid arteries supply blood to your brain. Over time, like other blood vessels, they can develop deposits, tiny buildups of cholesterol or calcium. That's common with age. But not every deposit requires removal. Often, it's actually safer to keep an eye on it than to rush into surgery. Here's where problems begin. Imagine you take the test and it shows a narrowing of 50% or 60%. That sounds alarming. So you're referred to a vascular specialist. Suddenly you're being offered a procedure such as a carotid endarterectomy or a stent. Yet if you had no symptoms, no dizziness, no weakness, no vision changes, these interventions may provide little benefit while introducing real risks. A major New England Journal of Medicine study followed more than 30 older adults with moderate carotid narrowing, but no symptoms. In many cases, medication and lifestyle changes reduce stroke risk as effectively as surgery. Even more concerning, A small but significant number of patients suffered strokes directly from the operation itself, either during the procedure or shortly afterward. Consider Helen, 82, from Pennsylvania. She felt completely fine and agreed to a carotid ultrasound at a routine checkup because her doctor wanted to be thorough. The scan revealed 65% narrowing. Within weeks, she underwent surgery. Unfortunately, she experienced a small stroke during the procedure. She survived, but now has partial weakness on her right side. I wish I'd known that doing nothing might have been safer, she said. So, what can you do? If your doctor suggests a carotid ultrasound and you don't have symptoms, ask, what exactly are we looking for? And how would the results change my care? Clarify whether the scan would meaningfully alter your treatment or simply add anxiety. If you're already managing blood pressure, cholesterol, and living a healthy lifestyle, an extra test may not improve your outcome. If a previous scan has already shown narrowing, don't panic. Ask about periodic monitoring instead of moving straight to surgery, and always consider a second opinion before agreeing to any vascular intervention. Let's finish with a gentle reminder. Your health choices matter. The right questions, asked at the right time, can protect you from unnecessary risks. Here's the takeaway. Not every medical test is risky, but not every test is truly necessary, especially once we're past 60. Our bodies react differently as we age. What seems routine, a contrast dye, sedation, or a standard scan, can have effects that aren't immediately obvious. A simple injection might cause a spike in blood pressure. A scan could provoke an unexpected reaction. Even a routine checkup can carry hidden risks if your system is already fragile. That's why it's crucial to pause, ask the right questions, and make sure every test is tailored to your actual health needs, not just a checklist or protocol. You have the right to speak up, to ask, is this truly essential? And to say, are there safer alternatives we could consider? Informed choices lead to better outcomes, and just as importantly, peace of mind. Your health journey matters, your voice matters, and here we believe every decision should be guided by knowledge, not fear, habit, or routine. If you've ever experienced unusual symptoms after a scan or test, or seen a loved one face something unexpected, drop a 1 in the comments. If not, post a 0. Let's share, connect, and learn together. And if this video has helped you feel a bit more aware, in control, or simply more curious, subscribe to Health Lab. We're here to uncover the facts, ask the tough questions, and always prioritize your well-being.